Asymmetric eyelid crease after upper eyelid surgery. Do I need a revision? Hello. I had an upper eyelid bleph done 8 weeks ago, and the creases look very different from each other, like two different surgeons did each different eyelid. The loose skin hanging over my left inner eyelid looks dreadful. Please advise if the extra skin can be removed as a touch-up in 3 months, or would I need a complete revision to match it with the other eye? I also had a lower eyelid fat removal at the same time. The left eye looks very swollen, like there is still fat left. I'm in despair. Please help. Thank you.
Thank you for your question. In your question, you stated you had eyelid surgery, upper eyelids and lower eyelids 8 weeks ago, and that you have been analyzing the way your eyelid creases look, that there is redundant skin over the left inner canthus, and that you feel that there's some puffiness in the left eye as well. And so, and you mentioned that it looked like two different surgeons did the surgery. So I think that one part of your preoperative discussion, and as well as probably your initial postoperative discussion, should cover the maturation of surgery. You see, for the type of surgery you had, and this is for any eyelid surgery, I always tell my patients that there is really an initial impression that we can conclude that overall the surgery was successful. That means that the incision lines look like they're healing well, that there is naturally going to be swelling, but true surgical healing can take 6 months to a year. Now, I follow my patients pretty closely, so we try to keep that dialogue going, and my door is always open. And I think that you may be projecting too quickly about what your final result will be. It is natural for there to be variability in swelling between the two eyes. It is not unusual to have an appearance of asymmetry during the early phases of healing, and 2 months is not that long after surgery. I always distinguish for my patients that there is functional recovery, which means that basically after 1 week, even for most of our eyelids and facelifting surgery, we can get people back to work. A little bit of makeup, but swelling and healing will take 6 months to a year. I think that it is important that you maintain some faith in your doctor and contact your doctor, communicate with your doctor about your concerns. I've been practicing surgeon for 20 years, and I can tell you that any doctor who has been doing this type of work for any length of time has experience and will probably be able to tell you based on your physical examination. A photo is good, but it's not enough in comparison to doing a physical examination of a three-dimensional appearance. So continue meeting with your doctor on regular visits, and certainly I suspect your doctor will be more than willing to do any type of enhancement if necessary. Every cosmetic surgeon is generally comfortable and understands very well that the human body is elastic, and there is some stretch and variability in healing, and enhancements may be necessary. But I think it's too early at the 2-month point to draw such a conclusion such as you have drawn right now. I think you just need to communicate with your doctor, and hopefully as time goes on your appearance will improve and you will have a result that you'll be satisfied with. So I wish you the best of luck. I hope that was helpful, and thank you for your question.